Hi, I'm Dr. Mitch Jackson. I'm in private practice for 22 years in Lakeville, Illinois, outside of Chicago. We've had the Diopsys in my practice for about 18 months. The reason why I chose the Diopsys is for many reasons. We have a lot of patients who are early glaucoma, glaucoma suspect, ocular hypertension, and I don't know what to do with those patients. We do visual fields, we do OCT of the optic nerves, and when there's damage on those, there's already cell death. Diopsys has different modules. It has ERG, pattern ERG. There's a concentric stimulus and a diffuse contrast setting. They're for different conditions. So the focal concentric is more for macular degeneration, drug toxicity like Plaquenil, and then the contrast, diffuse contrast is more for conditions like diabetic retinopathy and any of the glaucomas you're looking for. Visual evoked potential is more for any disease process pre-optic nerve as well as at the optic nerve. So you can also use visual evoked potential in your analysis for glaucoma patients and anything that might be affecting the visual pathway before it hits the optic nerve. So if you need to figure out where the problem is, that might decipher if there's something along the visual pathway, if everything in the retina and the optic nerve is normal. I also use it for conditions as early age-related macular degeneration or epiretinal membrane. Again, those borderline cases, it helps make the difference. I've also used the technologies, specifically visual evoked potentials, in patients who are not verbal, in patients who are malingerers. So it helps detect problems and catch those, fix those problems as well. The best thing is it's actually helping patients and helping me make clinical decisions, whether it's glaucoma, diabetic retinopathy, optic nerve disease, drug toxicity from Plaquenil. But the great additional feature is actually I get paid for this test. And most diagnostic tests, as we know, with reimbursements are all getting cut. This one averages with Medicare or the most common commercial care is anywhere from $180 to $200 for bilateral visually evoked potential or pattern ERG. Initially, there's some challenges with it. As long as you prepare properly, it will connect your EHR. Just make sure you have a port to plug it in where you're going to end up putting the unit, so that doesn't delay your implementation of it. Should also have a dark, quiet room. You don't want other tests being done in that same room, and it must be a dark room. So just planning properly, if you know a couple of these pre-expectation items, and then the transition should be very smooth. Technicians prefer doing this test over visual fields. So in terms of adoption by staff, they like doing it. It takes at most 10 minutes, but you have to put a little strip under the eyelid, but it doesn't touch the eye at all. It's just on the skin of the eyelid. And that's the only disposable supply that you might have to replace down the road, but it's still fairly inexpensive once you've bought the machine. Electrophysiology as a diagnostic tool, at first it seems a little overwhelming, but it's really simple, and they've made it simple. And they give you green, red, yellow. Interpretation patterns are easy. There's a new module coming out which might help differentiate between if you have a patient with cataract versus a macular pathology. It's called flicker ERG. So there's a newer module which will actually help determine if taking out the cataract will help when there's more than one pathology. So I can't wait for that module. So I highly recommend this to my colleagues.